While the quality of care patients receive in Saskatchewan has been and it continues to be excellent, and that is thanks to our dedicated and professional healthcare workers here in the province, the current level of pressure that our ICU staff requires that a few patients be sent out of the province to relieve some of that current pressure that we have. We will also today be asking for additional resources from the federal government, staff that can work in our ICU settings. And while we appreciate any help that the federal government can provide, we are also quite realistic and that this will likely not be a large number of staff, but it will be a very specialized grouping of staff that will be required. My answer would be it's a good thing we did act on the measures, significant public health measures where we did. It is a fair question. Should have we possibly moved forward? And people often say, is there things you would have changed in your response to this pandemic? Potentially we could have moved possibly a week sooner with the masking mandate, or maybe even sooner with the proof of vaccination policy that we had brought in place. I don't think anyone was reticent about asking for federal help. What we were doing through our Emergency Operations Centre that was just up and running was looking inward as to what resources do we have to increase our ICU capacity here, and we have increased it by about 10 beds over the course of when that Emergency Operations Centre came into play. Through Marlo Reynolds, he was reaching out through his contacts as to what other jurisdictions had for capacity if we needed to transfer some patients out like we do here today. Ultimately, do they have any ability to provide some of the very specialized critical care nurses, respirologists, things of that nature to Saskatchewan, of which provinces quite obviously don't, and what capacity the federal government as well would have to provide some of this very specialized these very specialized disciplines that we do require to support our current ICU beds as well as any additional ICU beds. So there was nothing, there was no one being reticent about making that request. It was about structuring that request so that with all of the partners, including our Saskatchewan Operations Centre, to essentially bring it forward like we are here today.